and delighted that we're now kind of moving from the international perspectives into a panel discussion that's going to kind of ground those in some Queensland and Australian considerations as we move forward. So I'm delighted to introduce and keep you on, Kate, but also to introduce two more panelists who are going to be part of our panel today. So the first person I'd like to introduce is Mr. Luke Twyford. So many of you will know Luke is the Principal Commissioner and Chief Executive Officer of the Queensland Family and Child Commission, recently publisher of the inaugural and nationally esteemed Twyford Review. So kind of setting up the landscape for significant safeguarding reform. And we move from one safeguarding reform to another in terms of considerations around oversight and safeguarding in the context of a secure care conversation. But we're delighted to be joined by Luke, who's carved a little bit of what has been a very busy end to the year to be part of this conversation. So thank you, Luke, for joining us today. And I'm also delighted and equally delighted, and especially delighted because she is now my board chair at PeakCare, to welcome Jo Roff to our panel discussion. Jo is the Executive Manager of Service Delivery at IFYS, one of the largest leading providers of care services in Queensland, and will be able to speak to us from that kind of context around practice, but also bringing kind of, I will say, decades of experience of practice and kind of practice excellence to the conversation that we're going to have today. So I have a tight series of questions. We do invite you to make kind of any questions that you'd like to kind of bring to the panel's attention, make a submission through to our Q&A. And we'll endeavour to get to those. If we don't, as I committed to, we'll provide some theme responses out following the session, just given the sheer number of people who are joining into this conversation today. So I'm going to kick off with you, Jo, if that's okay. So I understand you've had the opportunity to visit other jurisdictions across Australia who provide secure care. Can you start us off by sharing some of the insights and learnings that you've had from those visits that you've undertaken?
Thanks, Tom, and hello, everybody. I just wanted to say thanks for a great presentation, Kate. And it was actually my connection with Kate and finding out more about secure care that I was able to make some connections with different jurisdictions in Australia. And as Tom said, being someone who's a practice lead, I really wanted to see what they look like in action. So I was very fortunate to visit the Cath French facility in Western Australia. So that's actually departmentally run secure care. So it's a 6-bed facility that's been operating since 2012. And there's some rich data there as far as evaluation reports that have been completed that I encourage people to read. But very much that placement option for young people was around young people who are at significant risk for themselves, from others, and there was no other option available to keep them both safe and secure. So the intention of that model is very much a short stay with a 21-day admission period with the opportunity to go to 42 days. What some of the evaluation reports I read told me was that children were having multiple admissions. So I think, and Kate highlighted that for us, what was really important is thinking about our intent. So the WA model was definitely coming from a child protection framework. Children were being placed either from foster or kinship care or residential care, so they were actually taken to the facility. And of course, you all appreciate how broad Western Australia is. So for a lot of the First Nations children, that was definitely being away from their country. So the newer model has a lot more intervention from a cultural perspective. But what I was impressed about was the clinical oversight. The attention to children's health needs was really important. They had both nurses on site, but also mental health nurses to spend time with children. So that was really quite critical in relation to how they'd reformed that model. Then I had the opportunity to look at something completely different, which was the ACT. So in the ACT, they have actually legislated so that the Director General has the authority to apply for what they're calling an intensive therapeutic order, or an ITO. So that order is in place to actually either look at directing a child to have an assessment of their behaviour and needs, or actually a treatment in accordance with a therapy plan. Now, the key part of that is that there's a therapeutic panel. So all children are referred to that therapeutic panel to have a look at what their needs are in relation to moving forward. So moving away from what were the behaviours of the child to what is the root cause of how that child got to that situation. So then the Director General also has the ability to order a confinement order for up to 7 days with a repeat of 14 days. So I got to visit the facility, which was which was called a therapeutic safe place. So in that situation, the therapeutic panel oversees the work with the young people, but works really closely with the provider. So what was delightful for me was I got to sit in a meeting with all of the key stakeholders, and they had a shared risk framework that they were all working to on a daily basis and changing what they needed to do in intervention. The other thing that was amazing, because it is about the raise in age of criminal responsibility to 14 and the ACT, is the minute the child is placed in this facility, they actually work straight away on contact with family and community engagement. So that's really important. So if you're looking at a period of stabilisation, the overlay of the therapeutic intervention from a very highly experienced team, and then working closely with the young person and their community. So they're probably my two highlights, and I can talk a little bit more about them in another question, Tom.
Fantastic. Thank you, Jo. That's fantastic. And a great segue into my next question, which is for Luke. And Luke, in addition to your role kind of as the head of the QFCC, you also are the chair of the Child Death Review Board, who kind of makes recommendations to government from an oversight perspective. And with that, and drawing on some of that work, how can Queensland strengthen early coordinated support so young people with high-risk behaviours stay connected to stable care, education and therapeutic services as needs may escalate?
It's a great question, Tom, and it's almost the answer in the question. Through my work in the Child Death Review Board over the last 4 years, we've recommended the introduction of secure care in Queensland. But the recommendation had a bit of a trick to it at the start, and that was that Queensland government consider whether or not secure care should form part of its out-of-home care continuum, and if so, to legislate either way. What we see in the cases we review is unfortunately the absence of a service for the teenagers, generally in residential care or self-placing, who have escalating risk-based behaviours that corresponds to a distancing and an absence of government intervention. So I think most of the people on this line would be aware of the trajectory of childhood trauma leading to school absence, leading to alcohol and other drug use, leading to problematic sexual behaviour, leading to high-risk self-harming and other concerning behaviours. As we track that trajectory in the cases that we review, and roughly it's between 50 and 70 cases a year, we actually see government services dropping off. Once you stop attending school, once you stop attending health services, once you start to live in a transient manner where as a young person you are looking for hope and connection, what we see is government services retreating. And so secure care, from the intent of our recommendation, was about placing an intervention service on the care continuum that recognised that many of our current placements and services are not fit for purpose when we have a history of significant trauma appearing as significant behaviours escalating. And so to answer your question more specifically, what I would like to see and what the board has recommended is that we actually understand for any child in Queensland where the service is designed to best meet their needs. We get tangled up in a facility being misspoken as a service. We talk about outreach and intervention when actually what we mean is a program name. And so I think fundamentally we've got to distinguish practice from program, from service, from facility. And when we called for a secure care model, we meant all of those things. How does the current child safety, mental health, and alcohol and other drug programs in Queensland work together? for the one teenage girl who needs our help, or for the one teenage boy that needs our help. So I think it's been an excellent presentation by Kate. It shows the complexity of standing up a new model or a new service. What we have called for is it needs to be placed in the bigger picture of how Queensland assesses, responds to, and assists the needs of teenagers.
Fantastic. Thank you, Luke. And acknowledging the critically important work of the board and those members, it's so important that we take those learnings and apply them to honour the legacy of what's possible, also set up the future for children who can be supported well through those learnings. So, Kate, passing through to you and kind of fully acknowledging absolutely the complexity of what you've showcased for us, but also the opportunity of what's possible if we do learn from those who've gone before us, which is absolutely critical. What are some of the quick wins kind of we could focus on across Australia to bring secure care in line with a broader rights-based reform, kind of when you think about that in Australia and from an international perspective?
Yeah, thanks, Tom. As I sort of suggested, like there's really a cultural silence in Australia around secure care, particularly in regards to data collection and transparency. And I don't feel like we can really make clear calls and have really clear guidance on what secure should be unless we actually know what's been effective. So I think the start of all of that is just making sure that we have admission data that is available. And I do think the best place for that is within the AIHW, so the Australian Institute of Health and Wellbeing, I think it is, a child protection report. So that kind of gives a nice snapshot of our child protection systems and the interventions within those systems in Australia, and it doesn't include secure care. So I do think if we can include admission data for secure care, both in terms of facilities and also separate care, so when we lock our residential care facilities, then that can show us how secure care is being utilised in Australia, and then we can start having the conversation about, okay, well, what is working well? And then we can actually, whether it's partnerships with academic institutions or institutes, or it's just them being able to then access the data and then do some work leading on from that, we can start to build an evidence base and we can start to have a more outcomes guided conversation about secure care. So I think that is a quick win. I think all states and territories should be applying pressure to have that included within the AHW. But I'd also like to see the prohibiting of seclusion rooms in Australia. And I do think that is something that the Netherlands have started to pave the way. So I think in the last about 12 months ago, they changed legislation to prohibit the use of seclusion rooms. And I know the banning of or prohibiting of solitary confinement is something that has general traction, and that we're obliged to do, I think under one of the UN conventions. But I think we need to go that next step. I think we do need to also prohibit the use of seclusions within Australia, seclusion rooms within the welfare space. But I think that also speaks to the lack of national standards. And I would like to see a more national sort of guidance on what is expected by secure care in Australia, whether that be standards around the need to have legislation in place, that we should have legislation in place when we have secure care, those kind of standards, or whether we should have seclusion rooms as part of secure care intervention within Australia. And national standards might not be a quick win, but I thought I would just slip that in there. But also self-determination is something I think bringing the sector in, but specifically the Aboriginal sector into the conversation a lot more within Australia, because it has been government delivered, government led historically.
Fantastic, absolutely. And I think kind of when we look to those system enablers, linked data and transparent data that actually allows us to see how systems are performing is so critical. So a call for an AIHW data inclusion would be critically important. Joe, I might come back to you and kind of building on what you previously shared about that kind of direct experience you've had visiting many of these services across Australia. Could you outline for us some of the distinctive components of the service delivery models? And in particular, as we get into that kind of more granular detail, some of the key challenges those services have encountered that you're aware of?
Yeah, thanks, Tom. I think what was, as I highlighted before, what's really different is the intent. And I think whatever we do in Queensland, we have to be really clear on what is the intention we're looking at. So in the WA model, it got to a point where it was what they're calling a circuit breaker. So they had no other alternative but to place a child somewhere where they could keep them secure and safe. But then what is the intention? So what I heard in Western Australia, from a very well-resourced model with clinical oversight, security guards if needed, nurses, educators, cultural practitioners, was then step-down services. So where could children actually go afterwards? So you've had a period of stabilisation, helping kids to regulate, do those things they need to be safe and secure, but then we don't have those supports. And the level of supports when children were completed their time at the secure placement. I guess in hindsight, the difference in what I'm seeing with ACT is that support is following them. So having that therapeutic panel who makes the plan, who then oversees the placement and then follows through that plan is very different to what Western Australia is doing. And I think it's kind of a bespoke model that they've started with just one agency. But what that agency did was build a really strong relationship with a residential provider so that they had a really nice transition from the therapeutic place into a residential placement. So I think that's key when we look at our broader out-of-home care system, as Luke was saying. We need to have all of those elements as part of that. And I don't think I can stress enough the importance of that stakeholder engagement. It's not enough to bring in health or education as a partner. They have to be there in the planning and the design, because in Western Australia, what they found was most of the children had really poor educational attainment, and they felt that the pressure was on them to then turn that around. But what they did was argue to make children education ready, to re-engage them back into school. And we all know that's a protective factor in itself. So we can't let people stand on the sidelines saying it's too hard to come in to assist with that work. So the clinical overlay. The other questions I was interested in was in the workforce. So it's a particular workforce. Kate mentioned minimum standards, but we know now the challenges of recruiting staff across out-of-home care, but then to have people working in a secure facility, which isn't a detention centre, for a period of time. So I think we need to put our minds to how do we actually build a really robust system that we support people in an environment where we have many psychosocial hazards for our staff, to really be able to give kids the best care that we can when we're looking at these periods of stabilisation. I know the government may be very interested in a youth justice framework when we're looking at secure care, but we cannot stop and think about the whole wellbeing of children and young people when we're looking at what those outcomes are.
Fantastic.
Thanks, Tom.
Thanks, Jo. Completely agree. And I think with that, the criticality of actually all of those joined up service systems coming together as the key enablers, not just for the immediate intervention, but the ongoing support for a young person in the context of their family and community is essential. And kind of we always see kind of the drawback of that when designs don't include everyone from the start, and the criticality of if all those stakeholders need to be a critical part of the solution is having them at the table to design the solution. So a really great learning from other jurisdictions there. Now, as we close out in terms of the plan questions, and we have a myriad of Q&A questions coming through, which is absolutely fantastic. So I commit not to getting to all of them, but we will absolutely be considering some really great suggestions that are coming through. So thank you for those who have shared. Kate, I'm going to go to you, and then I'm going to close out with yourself, Luke, just to put you on notice. So you've kind of touched on them, but I wouldn't mind diving down into a bit more detail. And this is kind of stepping back into the drivers of reform that precede the reform itself. So those enablers, what have been, when you've looked at it in your research, what have been the enablers of secure care reform from an international perspective that you've come across?
So the Netherlands, definitely lived experience. So the voice of lived experience. And we really see an absence of voice in Australia of secure care, young people that have been admitted to secure care. So that was a very, very clear enabler of reform in the Netherlands. In Scotland, I think it was that youth justice reform that was happening in that space, but also just having secure care positioned within the broader reform sector. So as you're aware, secure care, Scotland have integrated the UN CRC within legislation. They haven't raised the age, but they're in the process of sort of raising the age, and they've closed their custodial facilities. So these evolutions have clearly will have clear impacts on secure care, but the government has really sort of been on the front foot in terms of, you know, commissioning sort of research in this space and looking at the impact that it's going to have and how they can sort of really work towards. And they say quite explicitly they want to be a jurisdiction that does not deprive children of their liberty. And so they know they have secure care at the moment, but they want to really reduce the number of admissions and aim not to have secure care ultimately.
Fantastic. And then kind of bringing us to a close in the formal questions, Luke, I might kind of come back to you and building on what you've shared and kind of just looking to tease that out a little bit. We talked about the idea of this kind of Queensland-wide continuum of care. So what should a Queensland-wide continuum of care look like? So when we think about everything from prevention, early intervention, all the way through to those very acute responses. And the hard question, who should be accountable for leading and publicly reporting on it?
It should look as simple as a picture on a page, with the complexity of each element on the page having detailed and defined service standards and performance outcomes. And from my view, those performance outcomes are about meeting the needs of children. Ultimately, are children better off because of our investment and intervention? And if they're not, what are we doing and why? I think we've touched on a few things today. And what I would also say is that continuum of care is also a better clarity on who shouldn't be doing what. You and I know, Tom, that there are people working in residential care homes who are using what the NDIS would classify as restrictive practices, but they're doing that without any legal framework for children in out-of-home care, placing themselves, the child, their organisation and the entire system at a level of risk that's unnecessary. If we had leadership within our state that would legislate who is allowed to do what and where, under what circumstances, so much of what we're talking about secure care, I believe, must have judicial oversight and judicial enablement, and it must have an independent regulator that is monitoring the data, and we've noted the lack of data. But ultimately, if you can't draw the system on a page, then we've made it too complex and too opaque and too vague. Understanding the difference between a child safety officer's case management role, what a residential care organisation offers, what alcohol and other drugs, Queensland Mental Health Commission, what roles they each play in the life of a child and how it fits together and connects is sort of the underlying theory of all the work in the Child Death Review Board. We unfortunately see those cases that have had a tragic outcome and then look back with the benefit of hindsight and see too many programs and too many services and too many workers involved in the life of the child, ultimately not leading to a more positive outcome. So that's the challenge in front of us. It's how do we articulate the roles of everyone in a child's life and in a family's life and how they're all pulling together for a better outcome where the family is empowered and the government is less likely to intervene into the future because we're actually being effective.
I think that's a really, really great summation of that, and kind of to bring that to a close and do justice to some of the comments that have been shared, which I just want to touch on. It's really important that we hold conversations around this, particularly around the idea of secure care. It is at times and can be an uncomfortable conversation, which means at times systems shy away from having the uncomfortable conversations. But what brings comfort is the evidence, the research, the insights, and being able to lead through and learn from the experience of those who've come before us. All of us in the role that we have, whether it's service delivery, systems stewardship, oversight, policy design, what are the best outcomes for children, young people and families. Universally, we know the best outcomes are delivered when children stay connected to both families and community. And if that is not possible for a time, we need the best possible continuum of responses that can act as interventions that allow that to reoccur, that give kind of security, permanency and support to children and young people. Thank you to our panelists who have shared that. I want to acknowledge that there is absolutely in the Q&A some great questions around practice, but also kind of when we think about this around our maturity and our ability to govern that, some of the hesitations and anxieties that might come across, kind of, are we mature enough in our systems and services and oversight to really meaningfully do this well? And for that, we have the amazing opportunity in Queensland of having a commission of inquiry walk alongside the design and implementation of this work. There is no better time, once in a decade, to look at how we set that up well from the whole of system perspective. So the peak body will continue to bring you and share with you and create and hold a space for conversation around the evidence without bringing positions, without bringing kind of ideas and inferences, but to actually create a space for you to hear what is being talked about internationally, to allow you to inform your position and advocacy, as well as kind of the collective base of what we bring forward based on the collective evidence. And as you've seen from Kate, there's a wealth of international research that we should be tapping into in terms of how we proceed in the design of the best possible system that supports children, young people and families. Now, because this is the Christmas edition of PeakCare's webinar series, it is the final webinar for 2025. And in delivering a small Christmas miracle, we are going to finish ahead of time, which is absolutely wonderful in terms of bringing you together. I do want to just close off with a couple of notes of thanks for everyone who's contributed this year, as well as today in particular, to bringing this conversation to life. It's been a wonderful year for the peak body, a big year for the sector and a really important year for setting us up for what comes in 2026, which is going to be a really significant period of reflection, change and opportunity, but ultimately designing a better system that can support children, young people and their families. There are 2 more announcements for the peak body for 2025. So stay tuned across our social media channels. For members, that'll be this afternoon. For general members of the public, that'll be tomorrow morning. An exciting announcement from PeakCare, and then also the yearly close of our Commission of Inquiry insights on Thursday before we ourselves move into the Christmas break. Thank you for everything that you've done as a service provider, as policy designers, as a government system, and the work that you have put into designing the best possible system for children, young people and families. The work that you have done has improved outcomes and will continue to do so. It has been a privilege to be your peak body. We wish you a restful Christmas break. For those who will be delivering services, we acknowledge the work that you'll be doing over Christmas to give children, young people and their families the support they need and deserve over Christmas. PeakCare has, and we've just launched our brand new website. So if you haven't been across, have a look. There's some great resources and services there. And if there's anything that we can do to better support you as your peak body, please do reach out to us. We love hearing from you. We are here for you and we are here to empower the voice that you bring and the expertise that you share. So have a wonderful Christmas break, and the peak body looks forward to seeing you again and supporting you in 2026. Thank you.